It's Rome and welcome to another episode of Homefront. And as we promised, we are back, JP and I, with the Prof. We brought him back, our professor in psychiatry. We have Professor Hutchinson with us. So welcome again for another episode, Prof.
Yes.
Now, the last time you were here, right, which was not too long ago, all of us in the same clothes, right? Is we were discussing the topic about the vaccine hesitancy and all of that.
Right.
And you know, I love my theories, right?
Yes.
So here's this theory. Here's this theory. So the theory was that people in certain groups line with each other. Meaning, all right, so let's say I'm a smoker, I'm a drinker, I'm a limer, I have a big belly. Most of the time would be my partners would be smokers, drinkers, limers who have a big belly too, right? Mm-hmm. Or if I'm an athlete, I'm athletic, I'm going to the gym or playing football, chances are alignment with those kind of people. Is the same thing, JP, now that we're seeing, where you would find the vaccinated people, most of their friends or family members are also vaccinated people. Mm-hmm. And then the unvaccinated group, if you're not vaccinated, chances are all of the people in your family or your friends group would be unvaccinated as well. So the trouble I'm finding is that because I personally, all of my friends and family vaccinated, so I don't know anybody who's not vaccinated. So I can't even get to convince them or persuade them to get vaccinated. So there's a disconnect. The theory is, do you think there's really a disconnect between the vaccinated group and the unvaccinated group? And then how do we reach and get to intermingle with each other so that we could share information, seeing that we separated socially?
Yeah, well, there is that kind of clumping, if I could use that word. Psychologists call it the confirmation bias, meaning that you would seek to be with people who share the same beliefs, who do the same things, because it confirms your own belief. Sure. Whereas if you hang around with people who don't, it challenges you and makes you uncomfortable. Mm-hmm. So to avoid what they call dissonance, it's much easier to be around people who are like you.
Also, there's a real thing.
So
I thought it was just a theory. I thought I had Rome's theory, you know, but I'm not going and sign up on it and I'm a PhD.
Good theory, though. Good theory. Also called Rome's theory.
But it's strong. And it strongly predicts people's behavior as well.
Right.
So I think that again, the question, and I think this goes back to our conversation the last time, is how do you reach people that are congregating and clumping in groups of not wanting to be vaccinated. Mm-hmm. Mm-hmm. And I think that the thing there is to identify where those groups are, whether they're housed in religious, people who have particular religious affiliations, whether it's housed in particular social groups, whether it's housed in where people live. And I think in doing that, the strategies to reach them would be informed by those being able to locate them in particular either places or behaviors.
So when you're saying is, for the first step is we have to find out who those groups are. Because JP, I will tell you honestly, I don't know who are the unvaccinated groups, because I am in my bubble of friends and family and co-workers who are all vaccinated. I don't know where these groups exist. So JP, in terms of both you and Prof, have you all been seeing any differences as to groups of people?
Well, I was going to ask Prof about that. Mm-hmm. Gender, I mean, do you see a difference, Prof, in terms of, even before we break up the groups, right, do you see a difference with gender? Do you find males, with regards to males and females?
That's difficult. I really can't say. I mean, traditionally, women do tend to engage health services more than men. Yeah. And I don't know if that's reflected in the vaccine numbers. Having said that, I think there's also the question of influence, and that same point about the direction of influence. And I suspect women will be influencing men more than men influencing women in this.
So of course, he's the red man, I'm the challenger, right? so Prof, I want to throw that back at you, because I find lots of women who have told me with regards to the household, they are in charge, right? Mm-hmm. But in terms of making that vaccine decision, they found that the male has been in charge, where if they want to go out, the husband will say, no, I'm in charge of the family. and you can't. So a lot of women haven't been going, or they might do it in secret because the husband has said no. So I mean, do you agree, or you think that so far women have ruled with that? Because I think men have been ruling with that. If we want to have a gender difference,
I mean, I'd be a little skeptical about how that actually, what that actually reflects,
Sure.
because I think that, as you said, I think women would tend to give men the idea that they're in charge.
Hello, Dr. Janine St. Bernard here, County Medical Officer of Health for County Caroni. Anyone who can take the COVID-19 vaccine should take the vaccine. Now let me be clear, the vaccine is not a cure, but it definitely protects you, like a seatbelt, which protects you from getting seriously hurt even if you are in an accident. That's what the COVID-19 vaccine does. It reduces your chance of getting the virus and spreading it. Also, even if you do get the virus, then the vaccine significantly reduces your chance of getting very sick and dying. It's that simple. So don't delay. Get vaccinated today.
actually, that's true. That's true. That's true. Yes.
And as
yes,
you
yes.
say, they would go out in secret, or
That's
they
what
would,
they do in all the time.
they would find ways.
That's true. I can't say
They would
anything.
find ways to get around it.
Right.
You know. So so I think that, and I think for a lot of things in this society, I think reaching women first is always a good idea, because I think if women, I mean, they have a lot of power, not just in terms of the influence on the men in their lives, but also in terms of, you know, young children and mindsets generally.
Yeah.
So I feel that certainly would be one group that we could reach out to.
What about let's say an economic difference? Do you think there would be a difference between the rich and the poor?
Well, I think there probably is. I mean, I think when you look at the vaccination rate, certainly, I mean, even with education, the other thing about the private schools and the prestige schools versus the, I think in one, you know, non-prestige school, they said the rate was like 3%.
Yeah.
You know, compared to about 70%.
And if
in
we
the
being
prestige
real,
schools.
percent,
right? On
90%.
home front, you know, we always be real. Is that I have friends who would have told me, boy, they went to, and they would have been living Westmorelands and some of the more, as you would say, in Trinidad and Tobago, big shot areas,
Yes.
right? And they said that they went to Mover to get their shot, and at the Mover Health Facility.
No,
And they say, if you see how many Benz and Beamer park up outside there, but they were saying that the people of that community wouldn't go in to get the shot. And then it brought up the question of, okay, is it a rich versus poor sort of thing?
Well, I think, and again, I think it comes back to the trust thing, and I think the disadvantaged or the people in the society who see themselves as being deprived, I think they are more likely to be distrustful and are also more likely to kind of rail against what they perceive as being imposed on them by the people who are rich, because they see those people as part of the conspiracy, you know, as part of the if you will, the group that might be likely to oppress them, you know.
Gotcha.
So and certainly I think that was an observation that many people made, that people from these, as you call them, big shot areas, were in all kinds of health centers, visiting places they never went to before, just to get a vaccine, you know. So I think, and I think there's also a parallel with education, which is unfortunate, because I think that just like with that prestige school, non-prestige school thing, that it kind of reinforces not just education, but opportunity and you know, that same network thing you talked about. So if you go to a prestige school, you're likely to be around
Right.
Yeah,
a
the
particular
algorithm,
group. So
yeah.
it's going to influence how you behave. So I think it's certainly something that we, like I said before, we can't look at it as one size fitting all, and we have to adapt the strategy to the group that we're trying to reach. And I think for the people in those areas, it's not just about vaccines, it's about, you know, all the services that they feel that they're being deprived of or not being able to access. You know, so again, it has to be holistic too.
Gotcha.
JP, what about the healthcare workers?
Well, Prof, yeah, so as a healthcare worker, see with my little scrubs and stuff,
Yes.
I find it's interesting because, Rome, we have had 90% or more doctors, but less so with nurses, that's less than 50%, and also like, for instance, the laboratory technicians and the medical record staff, less so. So what do you think about that, Prof?
It's the same hierarchy, it's the same kind of,
Right.
the same kind of hierarchical organization that the people at the top of the tree
Right.
are more willing to engage the system, and the people who are below them on the tree are less likely to do that. And again,
The same trust factor.
yes, paradoxically, in seeing the people at the top of the tree do it, it reinforces their desire not to do it. You know, so it's I think it's and again, I think they have some valid difficulties with the system, and again, that perception that the people, you know, the managerial class, the doctors with regard to the health system are more favored. They, you know, they have more privilege. So,
But what can we do though in terms of, because the fact is that, you know, at the end of the day, I really don't want to have persons die. That's my bottom line. That's why I'm here with the Red Man, with you, just to make sure we talk to the public and give them the information. As you mentioned, Prof, about, you know, having a softer approach, but I want to make sure I give the public clear, trustworthy information. So my question to you is that, what do we do with those nurses and those other healthcare workers? How can we persuade them?
Well, before you answer that, Prof, and before he goes to that, JP, we want to head to our mindfulness moment.
You want to relax before?
Yeah, we have to relax because I want to hear that answer. So all you don't go and play it. We want you to relax. Breathe in the positivity, breathe out the negativity. We head to our mindfulness moment.
Hello and welcome to our mindful moment. Today I want to talk to you about a mindfulness of sounds. We were exploring the role of the anchor. Like a ship, an anchor keeps us from drifting and being easily distracted by the day and what's around us. So we can use our awareness of sounds to help us be anchored in this present moment. And let's practice that a bit together. So I'm going to invite you to get into your mindful bodies, spine straight, nice and relaxed. Close your eyes if you're comfortable with it, or if not, look at a point on the floor. Just take a second to settle in and just listen to any sounds around you. Is there anything that you're noticing in the room or maybe outside? Maybe a sound that you've not appreciated before. What do you notice about it? Good. Excellent. And when you are ready and comfortable with it, I'm going to invite you to open your eyes. Just spending a second or two being aware of the sounds around us can be a really powerful tool to our nervous system to remind us to keep our attention in this moment. So practice being mindful of sounds and remember to be here now.
It's Rome, and we are here. We're chilling with the boys. We're living with the kids. We're doing this all for the PED Cares Foundation. So we need you at home watching us to go donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You all ready? On three, we go and say yay. 1, 2, 3. Yay! The PED Cares Foundation. And we are relaxed. We are relaxed after our mindfulness moment. And Prof has to answer that question. JP was asking the question in terms of the disparity,
the
the
nurses,
difference in the nurses, the doctors, right? So Prof, what do you recommend?
Because I want my nurses, I want it where the nurses who are on the front line, I want to make sure nothing happens to them. So I want to make sure they get their vaccinations to add that protection. I want all the healthcare workers to have that.
You see, and before you answer that too, Prof, and it also kind of makes it difficult for the average person to go get their vaccine, JP.
Yeah.
If you go into a hospital where the nurse who going to give you the vaccine not even vaccinated. So what do you advise?
Yeah.
Well, I think, again, the approach has to be holistic. I think it's not about the vaccines at all.
Okay.
And I think that we have to engage them in terms of trying to understand why they are so reluctant and to address some of the issues they have, because a lot of nurses do feel that the system is not kind to them, is not giving them the kind of opportunities they seek. And I think that applies to the rest of the healthcare system. And as you know, we have a high number of nurses who migrate.
Yeah.
And one of the big reasons they migrate is that they feel that working here is like a dead end.
Yeah.
They feel like they're almost abused in the system. And then they retire and, you know, another set of nurses come on the treadmill. So I think it's about reaching out to them in that way, not making it an issue about whether you have the vaccine or not, but really understanding why they feel the way they feel. And,
so you prefer that approach versus the big sick approach of saying, listen, you have to go get vaccinated?
Definitely.
There's a recon mission first. Find out who, find out why, and then talk to them about vaccination.
Yes, yes.
And that leads as well to the teachers, because now we were trying to encourage all of the students to go get vaccinated to get back out of school. But no, we have a lot of teachers who aren't vaccinated, which is a surprise to me, because we were speaking about the difference with the education.
Yes,
And I would have thought, well, okay, with teachers who would be the ones who actually instill in the education onto the students would have had more information that they would have taken it. But we have not seen that as
Well, again, I think the distribution of teachers, I mean, they come from the same society.
Of course.
And I think they represent, perhaps to a larger extent than we think, the part of the society that is resistant, because, you know, they have to relate to the to what they perceive as their status quo, and that status quo, where they live or who their families are, might be people who are not willing to take it. So although intellectually they might be considering it and perhaps being swayed toward it, when they look at belonging, when they look at identity, when they look at being part of, you know, their host community, they don't want to.
So they reflect society.
Yeah.
Right. So how about going with that, piggybacking from Rome's point, how about the children do? Because I was also surprised, because again, I think my algorithm is where, as we were talking about the bubble, I'm also in a group where we vaccinate. I had to, you know, I'm going to get my vaccine first. I want to make sure I protect myself with public health measures and the physical health and immune health and mental health, right? But I realized that that wasn't as reflected in terms of the children, because when they actually offered the 12 to 17-year-olds to get their vaccine, I thought we were going to have more children coming out. What's your thoughts?
Well, again,
on
I
that?
think it's the parents, and I think with children too, there's the additional issue that the approval for the vaccine for children came afterwards, and so the issues of safety and the sense that if damage is done to a child, the consequences are much graver. So I think with children, the hesitancy might even be greater, because you feel that you might be doing really long-term harm to this child if you believe that the vaccine is harmful. So I think, and I do think we've, again, in general, we did a good job of kind of persuading people about the safety for children. I think there's still question marks about it.
So,
who
Prof,
them-
before
yeah.
we go and before we wrap up, in terms of, we spoke about the different groups, we spoke in this episode about the hesitancy, and JP is facing a challenge in terms of the healthcare workers, convincing them to go and get vaccinated, that sort of thing. So what advice would you have in terms of an approach, specifically for JP, in terms of the
Yeah.
health, in terms of the health sector?
For me.
Because, as you said, 90% of the doctors have taken it, but not so much the nurses and the clerical staff and that sort of thing. So what advice would you give?
So generally, just health sector
So
generally.
I think it's three things. I think it's about information, as you said, but information given in a non-coercive way. I think it's about patience. So it's not about pushing and insisting. I think it's about, working together and really trying to be gentle. And I think it's about managing the risk. In other words, it's not so much about life and death. It's not so much about me versus you. It's just about managing risk. And I think if we're able to convince them that when you weigh the risks, the vaccine is the better option, I think that is likely to be more persuasive.
So can I tell the population, Room and Prof, if you all can, listen to the Red Man, if you weigh the risk, Red Man, I think that...
Do the risk assessment.
Wait,
Do the risk assessment. And JP, we could probably get some stats from them in a later episode to show them the difference between your chance of survival, whether you're vaccinated or you're not vaccinated, to help you to make that decision. This has been another great episode of Homefront with the professor himself, Professor Hutchinson. Thank you very much for joining us as usual. We still had to bring you back again. We had to bring you back again, JP. JP, thank you for being a part of the team as usual. And make sure you go and keep on donating to PED Cares Foundation, right? So let me take a sip.
Credit card, or what else? I think they have direct transfer.
You can do direct transfer your credit card, send your donations to pedcares.org. Go on the website and make those donations. Thank you very much. My name is Rome. We're going to catch you for another episode of Homefront.